The consequence of that, the consequence of that is that many individuals are sick and die for cardiovascular diseases. If we look at the leading cause of death globally, this is data from the World Heart Organization, we can see that the first cause is ischemic heart disease, with more than 8 million individuals dying every year. And in the Interheart study, we found that at least 50% of these deaths are attributable to high cholesterol levels. The second cause of death is stroke, with more than 6 million individuals dying in the world. And again, in the inter-stroke study, we found that cholesterol or dyslipidemia is responsible for at least 1/3 of those. And there is wide evidence that the diagnosis and control of the dyslipidemia worldwide is very poor. So those are the pathway that the experts that work from the World Heart Federation developed. This is for primary prevention. The first step is screening and risk stratification based on cholesterol levels and other cardiovascular risk factors. The second is the initiation of statin treatment and lifestyle modification for the patients above the agreed threshold. And the recommendation is for those who are below this threshold to have this reassessed after 1 or 5 years, depending on the resources of the country. The third is monitoring of the effectiveness of statin dosage after 3 months, adjusted of the dose, or maybe add new medications that are now available to control high cholesterol. And finally, and more importantly, is to support the patient for the long life adherence with lifestyle modification and medication. For secondary prevention, we have a shorter step because we already know that all of them are high risk individuals. So the first step is to initiate high intensity statin treatment and lifestyle modification, and also add the other treatments that are well known to reduce cardiovascular risk. The second is to monitor the effectiveness of statin dosage after 3 months, adjust doses, and add alternate treatment if necessary, and again, support the individual for all his life in terms of compliance and lifestyle modification. And there is an additional area of interest for the federation, that is the familiar hypercholesterolemia, that it's supposed to have a prevalence between 1 in 200 to 1 in 500 individuals, and it's a very low recognition in general all around the world. So the first step is the identification of cases based on diagnostic criteria, and this depends very much on the country resources. If the familiar hypercholesterolemia is suspected, it's very important to screen all the first-degree relatives, including children. I saw in the program that you have many presentations regarding dyslipidemia in children, and I'm sure you will have the expertise to plan for that. The third step is to initiate statin treatment for everyone suspected of FH, to monitor the dosage after 3 months and support this small but very important group of individuals for all his life. So in developing the roadmaps, we have these 6 steps suggested. The first, it's one you are doing today, that is to develop a global framework informed by evidence, health system, and the policy, national policy. Then to summarize the magnitude of the problem and to develop evidence-based recommendations, to identify the gaps, identify the roadblocks to reduce premature cardiovascular mortality, offer evidence, but very often based more on evidence on consensus, given that for many situations we don't have very strong recommendations, so expert opinions become very important. And finally, suggest a step-by-step process to be adapted by the whole country. I dare to put some examples of potential roadblocks. One that has been identified is poor access to laboratory facilities or professionals for cholesterol management. And some suggestion is to use point of care measurement or to develop screening programs. There is a low awareness of FH among the general population and also among the professionals. So the programs to provide the community and the professionals education on the topics are important. In some part of the country, in the world, studies are not affordable for all individuals. So the recommendation of having a provision of free or subsidized lipid-lowering medication is important. And final example is the low awareness of the importance of persistent adherence to lipid-lowering medication. So there is many strategies that have been developed to overcome this. One of these is the use of text message reminder. And again, I dare to put a few examples of potential solutions. So regarding the lack of knowledge of the disease in the overall population, to have screening campaigns is important. To have a simple national guidelines for screening with a risk chart accepted by the country. I guess you follow the European guidelines, but in other part of the world are more national. With the initiation of statin treatment, it's important to have simple guidelines that can for general practitioners, especially in primary prevention, and campaigns to inform the people about the balance between safety and efficacy of statins. And regarding the health system level roadblocks, the importance of having free or subsidized drug provisions, reduced taxes or use of generic drug is important, and includes the advances we have with the mobile technology to support the patients. So this is my last detailed slide. This is the process that the World Heart Federation has been promoting in different sessions in different countries to implement this pathway. Start with the situation analysis to develop a specific focus and objectives for the country. Decide where you will begin. Will you start with pilot studies? What are the key stages for development? What do you need in terms of resources, human resources, financial resources, equipment? Who will lead the team? Will you have administrative support? How you will define the goals and plans for your development? And who are your main stakeholders? And finally, how to consolidate and strengthen the political will and by in the stakeholders. How important is advocacy? The World Health Federation, as one of its major roles is advocacy, really. So we recognize that our roadmap needs to be adapted at the national level. I'm sure with the program I saw for this conference, you will be very successful in this challenge. That's all I would like to say, given my limited knowledge of your language. I regret I will leave after that. If there is any comment from you, I would love to hear it.
Thank you very much for this excellent presentation. It's quite inspiring, this roadmap also for our country. I think we are quite good in information our people, but nevertheless, the knowledge about FH and hyperholesterolemijo in practice is unfortunately not so high as we would like to be. If there's any question for Dr. Lanas, I ask you to tell me that, because he's now with us, and he's going to leave us after his talk.
For now, there were no questions.
No questions
for Dr. Lanas. Just a great thank from one of the participants, telling that your cooperation is another example of excellent cooperation of Chilean experts in the WHO networks.
Wow. Well, thanks a lot. And as I said, I wish you a very successful meeting, and we will be looking forward for hear from you.
Results of this meeting. Thank you very much once again.
Okay. Thank you again. Bye-bye.
Yeah.